Okay, we'd like to welcome everybody to our annual October event, virtual edition this year. So, welcome to those who are regulars of ours who we see every single year, and then welcome to those who are new and this is your first time joining us. So, it looks a little different for everybody. Um, I would love to just say thank you for taking the time out of your busy schedules and out of dinner time to sit in and listen to what we have to talk about. Dr. B, if you want to go ahead and get started.
Okay, well, great. Well, I want to add my welcome to Megan's. We really appreciate you taking the time to join us today. Hopefully, this is some refresher information as well as some new information, and we're really excited. So stay tuned as we get towards the end of the presentation to reveal to you, give you a sneak peek of some of the newest technologies and things that we're adopted. We are located in St. Simons. We have a full service medical spa. And Megan and Caroline, my nurse, helped me in that arena, and as well as an on-site surgery center. And we basically provide services from head to toe. So I think first we're going to start off with some principles. Getting beautiful is a process. We all want a magic wand, but the point is, with the exception of a few things that are close to magic, getting beautiful is a process. It's not a one-time thing that you do and all problems or issues are fixed. I think another principle is basically our face is a weather vane. And so the question I want everyone to ask themselves is your face giving an accurate forecast of your mood? Now, I've had several people in the past as well as recently. Of course, we're all doing Zoom and Google Meet a lot more. You're having to stare at yourself, which, nobody likes doing that. And people will say, well, people keep asking me, are you tired? Are you sad? Are you mad? Well, if you keep getting asked that over and over again, then you may end up getting a little bit irritable. But that's where our job is to do a whole person analysis to help match your outside appearance to your inside mood. And so when I do that, I'm basically going to look at three elements. I'm going to look at skin texture, tone, and pigment issues. I'm going to look at soft tissue. Do you have furrows? Would Botox be helpful? Do you have thin lips? Do you have too much fluff in one area and not enough in another? And then lastly, the third dimension that has been enormous for us is a notion of looking at someone's structure. Okay, so we're going to get into each one of those in successive slides, but that's what we call a mixed media art project. There is a saying that when all you have is a hammer, then the entire world is a nail. And there are some providers that really all they can do is Botox, or all they can do is fillers, and they can only do it a certain way, and then that's going to limit what they can do for you and what they can accomplish. So when we talk about a mixed media art project, starting on the soft tissue side, that's where Botox fillers and lipo contouring, removing fat from one area, adding it back to another, that plays a role in that arena. When we look at skin, we're going to be looking at professional skincare, and we're going to look at things that we can do to make the skin brighter and tighter. And then finally, we're going to go look at structure. And in that, we're using fillers as structure, and that's specifically called a Y lift. So in the skin arena, you can see we have a lot of tools in that toolbox. And certainly, if you all have any questions, you're more than welcome to email or chat with Megan, and we can also get you hooked up after this with Caroline, our nurse. But we're going to look at professional skincare regimens and some of the other technologies that are available nowadays. So this is what we don't want you to do. We don't want you to take matters into your own hand and end up using Colgate or some at-home skincare regimen that you got off the internet, and then end up with some of the issues seen in the young gal on the left. So I think, the point is that when you move with home skincare regimen, and we have, several different options here at the office, what you're getting is you're getting pharmaceutical grade ingredients, and you're getting professional oversight and instruction and coaching. So that in general is going to equal safe, dependable results. In this category, we have the VI peel, which has been a great boon to us. In that in the past, peels were a little bit more primitive, and they did hurt, they did cause redness, and you definitely were raw. But this is something where they've come up with, we'll say an almost magical mixture, in which there is no pain, there's no redness, no rawness, and all there is peel. Now, Megan will tell you that I'm a little bit of a chicken when it comes to getting things done, and I tolerate this particular peel just fine. As a matter of fact, I had one done on a Friday, and that Saturday I was entertaining a bunch of kids for a kid's birthday party. Of course, they didn't really care what I looked like, but it's, essentially no downtime. Now, this is a gal who's had just one peel, and you can just see how much better her skin looks. You can see the tone is better. You can see her skin is brighter. She's had a reduction of wrinkles around her mouth. Everything looks better and brighter. And this person, it looks like someone you want to engage with, where the other person looks like they're sort of sleepy and maybe a little bit irritable. And all this is from a peel. Other technologies include the Lumeka, that is a photofacial, and that really deals with what we call spots and dots. And so it can be used anywhere. It can be used on hands, it can be used on décolleté, and obviously we do use it a lot on the face. And that's very helpful in getting out brown dots and redness. I would encourage y'all, if you have any questions, you're more than welcome to put those in as I talk, or you can save it until the end. We are going to be covering a fair amount of material. This really needs no explanation. This is, laser hair removal. It does a great job. Now, it will take more than one treatment in order to get this type of a result, because the hair has a hair growth cycle. And so there's, at a single treatment, that because the hairs are at different stages and phases of the growth cycle, then you would need a second one in order to catch, we'll say, kind of the late blooming hairs. But it's great. Okay, now I said we don't have any magic wands, but we have things that are almost magical. And I'm telling you that 3 years ago, 5 years ago, we did not have the technology to do this. This lady has just horrible skin. I mean, this is what one of my bosses used to call pine bark skin. So you can see all these etched in horrible lines and creases. And so this is Morpheus 8. This is a technology that uses a combination of radio frequency and microneedling. We put numbing cream on the face, and that basically makes it pretty comfortable. Again, I'm a chicken, and like I say, I laughed through this whole thing, but it was because Caroline was telling funny jokes. But anyway, this is wonderful, and I'm going to show you this. This is a gal that we use this technology on just 1 month ago. So it's 4 weeks ago. Again, this is not something in the past that I had. This is not a surgical case. This is what advanced technology can do. And I mean, this jawline is great. This is no surgery, no anesthesia, no downtime. So we are just really excited about doing this. Now you can see this gal has some spots and dots. And so then that brings us to this notion of a mixed media art project. Same thing, this gal that we saw earlier, she still has some ingrained crinkle wrinkles. She still has some thin lips. So if she's looking for a full facial treatment addressing both the skin and the soft tissue, and structure, then these are some other choices for her. Talking about Botox, hopefully many of you are relatively familiar with what Botox can do. These are the different areas that we can do Botox in. Botox takes about 3 to 5 days to take effect. If you're a newbie to Botox, it'll last about 3 to 4 months the first time. But as you do it over time and retrain those muscles to be softer, then it can last up to 6 months. If you've gone to other providers, a lot of other providers will have charges that are per unit. We're more focused on let's use the units we need to treat the area and the issues that we're dealing with. And so that's the reason why we do it for areas. And so then this is just another example. Obviously this lady has crinkle wrinkles, and this is same expression, but a lot softer. Now, one of the things that we find sometimes is gals will say, well, I've had Botox before. I mean, it just doesn't seem to be working as well. For Botox to bind well, it needs plenty of zinc. And for those of you that have been watching the news or been doing any kind of reading about this lovely COVID virus, you will know that zinc is essential to the function of vitamin D and is essential for your ability to fight off viruses. So if you want to fight off the COVID virus and want your Botox to work, then you probably should take like an extra 30 or 40 milligrams a day of zinc. Now we're moving on to other soft tissue things, which are fillers. Again, there's a host of names of fillers that are out there. I particularly like the Juvederm family because they have fillers that range from very soft for areas where I just want some nice volume, like the lips, but I want softness, to very structural. And we're going to get to that when we get to the Y lip. That's where I use Voluma. Now, I think this is an important point to make. Sometimes, especially as people have specials and things are discounted, there's this thought that all Botox is the same and you just need to get it at the cheapest price. Well, what I'm going to tell you is that Botox and fillers, anybody can shoot it in, and a lot of people do. But I've also taken care of a lot of patients who just had it thrown in there and have had consequences from that, where their brows dropped, or they had huge puffy lips, or they couldn't even raise their forehead. So all kinds of things like that. Now, no matter who does it, there's always stated risks and complications. But I think in coming here, you're going to come to establishment where we've had plenty of experience in this. And so you really want someone who is looking to sculpt the filler to match to your natural anatomy. And this is an example of a gal who naturally has sort of thinner lips, but they've thinned over time. And if you look at that, if you can ignore some of her curly hair, she almost has a masculine look around her lips. And here you can see, of course, I've just gotten done doing it, but you can just see we've restored some natural anatomy, a really nice light refraction of her cupid's bow, some gentle fullness of her lower lip. Basically what we've done here is we have restored for her what her lips would have looked like 10 or 15 years ago, and given her that more softer feminine look. Okay, so now we're going to move on to structure, which I like to call the third dimension, and I'm going to use this tent as an example, but the ladies that are models are, living examples. In the past, we just dealt with saggy skin as if it was too much, and so we just remove it. And so people would have a tighter face, but it wasn't natural looking, okay? So what this structure's third dimension does is it allows us to reestablish the structure of the face so that skin is redraped over that new structure. Now, why would we lose structure on our face? Maybe a question that you have, and the next slide is going to answer that. So here we go. We can look. This is a graphic design, but it basically shows that over time we lose bone in our face, just like in our back, our legs, those types of things. And so, but as we lose bone, we lose structure. And here's a picture of a gal who didn't take good care of her teeth, and as a result, her whole lower jawbone, she's lost volume there, and as a result, things don't look healthy and refreshed. She looks like shriveled up old lady here. Okay, so how does that play out in real people? I'm gonna go to this, and then we'll show you some pictures. This is the difference between filler as structure versus just filler and dumped in there. Some people will call this technique a liquid facelift, but basically they're just putting a lot of filler underneath the skin and inflating it like a balloon, which ends up giving someone sort of a round, poofy face, which is not particularly attractive or youthful. In the technique that I use, I am using my anatomic experience and knowledge, and I'm specifically placing that filler right next to the bone, underneath the muscle, and that filler then acts like structure in that location, and it also lasts a really long time, like 3 to 5 years. So that is the difference. There's no anesthesia with this. There's no incision. So this is a non-surgical approach to placing structure back in someone's face. And so this is called a wide lift. And you can see this is an example of a gal who had it, and you can just see much improved structure, better jawline here. This is one of our patients using those same principles, and you can just see lovely jawline, restoring what she had. We also did a little bit of soft tissue filling around her lips. Now you can see who would benefit, certainly from Morpheus or some VI peels, but for her, this was enough that she accomplished in this where she wanted to go. And the nice thing is she can do skincare. In other words, this sets the stage for anything else that she's interested in down the road. And this is a younger gal. Again, this basically looks like a tired out older sister. This gal has taken advantage of what we're going to say the mixed media approach. She's had some skincare and some VI peels. We've done a little filler around her lips, but you can just see that we've restored a youthful shape to her face, as opposed to this sort of, we'll say, granny mouth, granny jaw. Now we're going to move on to body rejuvenation, and I guess I'm going to take the opportunity to pause and see, Megan, are there any questions that you want me to address about that first part?
Not yet.
Okay, very good. So moving on. Okay, so as we said, this is sort of a flyover of the many things that we do here. There's many different reasons why ladies decide to do body rejuvenation. A lot of it has to do with time and gravity, and of course, children. Okay, so I think, again, we like to apply this principle of helping you achieve your most beautiful version of yourself, as opposed to, some sort of Barbie fake Kardashian look. That may be popular in Hollywood, but certainly not here. One of the things is that implants, a lot of times if a gal gets and is doing some research on augmentation, she can get very focused on CCs. That is not the most important part. It's keeping in mind that implants come in different projections, and choosing that appropriate projection for her frame. And so we choose the appropriate implant based upon her measurements and her goals, not upon, as I've heard some folks use a Playboy magazine to say which one of these gals do you want to look like. So we are going for a natural look, not as we call it, an entertainer look. And so this is a gal who didn't have very much to start with, but is just pleasantly upsized. And we like to call it the tan line. We know that she's enjoying this because of a tan line there. Another tan line. Okay, this is a gal that had a little bit more breast tissue, but just wanted to be a little bit more fuller and a little bit balanced and losing some volume after pregnancies. Now, talking about that, sometimes with pregnancies, our breasts do a little bit of the saggy, draggy thing, and in some practices, in an effort to avoid doing a lift, they'll just go bigger and bigger with an implant. And one of the things my bosses used to teach me is that, of course, the more you give gravity to work with, the more gravity works. And so while this is about a 300 cc highly projected implant, there's some folks that might have put a 600 cc implant in her. Well, that would maybe look very big initially, but over time that would sag very quickly and be very unattractive. So how do we deal with that? Then we do what's called a mastopexy or breast lift. So we're actually reshaping the breast so the bra doesn't have to be a hoist. And so we can do that in combination with augmentation. And so this is a gal who's had augmentation, and she's had a breast lift using an incision right around her realus. Now, this is a gal that had plenty of breast tissue. As a matter of fact, she had a little bit more than what she wanted. But in her, we did a breast lift, small reduction, but no implant. She didn't need implants. We had plenty. What she had was she had way too much extra skin, which gave her this, saggy, draggy, grainy look. We're going to move on down, and we're going to talk about some muffin tops. And so then here we have a gal that, when I'm looking at tummy tucks, I'm looking at, again, anatomically and structurally, I'm looking at what kind of muscle tone does she have? Does she have any hernias? What is her fat distribution? How can we make that more harmonious? And what kinds of extra skin does she have? And so this gal, we did the whole kit and caboodle. This little scar right here is her old belly button hole. And you can see, if you look closely, this is the same mole. And so you can see how everything has transitioned down. And of course, these two moles were taken as part of her tummy tuck. Now, this gal's a little bit different. She has different needs. And so for her, we really focused on doing some liposculpture here and removing this extra overhanging skin. So for her, I didn't need to move her belly button, but rather we just hid this. You can see her bikini line too. And so this is hidden neatly right up underneath her underwear or swimsuit bottoms. As we move on to things that are less invasive, liposuction definitely is a way to contour those areas that have gotten a little bit thick. Of course, we've all experienced that as we've kind of sheltered in place and had opportunity to engage with our pantries a little bit more than usual. And so here's a gal who her skin is good. Her muscle is good, she just has some extra fluff. And so we're just using liposuction as a means to just provide a better contour. This is another gal, again, who has an overall nice shape, but just a little bit of extra fluff. And we're using liposuction to improve that. Now, some of the exciting things that we are moving forward with is doing liposuction, no general anesthesia. Doing it with maybe a little bit of sedation, but mostly just local. And the gals who've had that done have found it to be a very easy and pleasant experience. So we're excited about adding that to our toolbox. We've sort of hit upon some of these procedure details. Pretty much everything I've shown you can be done as a same-day outpatient procedure. We do have an on-site surgery center. And in that, we can do everything from local only to light general anesthesia. Most of these procedures are within a 3 to 5 hour window. I think the big thing as far as recovery, especially for the larger things, is I really don't want you soaking in a jacuzzi, a hot tub, the ocean or pool, while before your incisions are totally sealed. And you really want to avoid doing things like horseback riding, pogo stick jumping. I know this is impairing a lot of people's activities, really for the first 4 to 6 weeks, but most usual activities are fine. So as we were looking to expand our offerings and put more tools in our toolbox, these are the main things that made a lot of people anxious about having surgery or seem to be obstacles to having surgery. Dealing with scars. The biggie was anesthesia. And of course, we all want to have limited downtime. And so some of the things that I'm going to talk to you next, as far as our sneak peek, are going to address that. So it's going to address all of these issues. We're going to call this our triple check. Our sneak peek, our triple check. Here we have is our new technologies, and you can check out our website and I'll give you even more information. The InMode website has lots of photos, but it's face tight, AccuTight, Morpheus, and Body Tight. And so the whole point is we can now remove the fat and shape it and tighten skin more predictably. So here's some pictures. This is the Morpheus. This gal we did has a nice flat tummy, but a lot of crinkle wrinkles. And so this is just after one treatment. Again, this is something that I could not achieve surgically because this is a skin texture issue. So Morpheus is really good at dealing with skin texture issues as well as tightening the skin. Ideally, I would like for her to have another treatment, but she was happy with one. So that is a satisfied client, makes us all happy. You can see, again, this is skin tightening, and that's using just the Morpheus. Just numbing cream would have been applied, and then the device is a handpiece that basically stamps into the skin, applying the energy. Okay, now some of y'all may be thinking, okay, well, what is the difference between cool sculpting and Body Tight? I have boys that like to play in our ice when we get ice out of the refrigerator, out of the freezer. And so, and maybe y'all have messed with ice in a hair dryer. So ice in a hair dryer, you will melt the ice, that is for sure. But there's no way that you're going to be able to sculpt and end up with a lovely ice sculpture like the figure on the right. And so that's with cool sculpting. For those of you who are not familiar with it, basically it's these little clamp-on devices that are put over your areas of concern, and the provider walks out of the room and you just lay there and let it melt, just like turning on a hair dryer on ice cube. That technology just doesn't have the ability to do shaping. And so then these are some examples of how this is a no cutting, no anesthesia, very little downtime of removing fat and getting a nice, tighter, attractive tummy. So again, my little triple check. Same thing on this gal's hips and up here, just getting a much improved contour. Again, no anesthesia and very little downtime. This is a phenomenal result. And this is very hard to go from fluffy to slender like this, and to get the skin to tighten up like that. That is very impressive, and certainly one of the reasons why we added this technology to our toolbox. And this is another really good one where you can just get that lovely tightening of the arm. In the past, we would have had to do this with a surgery called a brachioplasty that involved an incision down the back of the arm. And while it did a really nice job of improving the contour, there's just not a good way to hide that scar. So this does not involve any incisions. It's a little porthole, maybe 2 or 3 of them. The energy is applied, the extra fat is removed. You would need to wear a compression garment for a few weeks, but other than that, you return to your usual activities. And again, this technology is not limited to one part of the body. This is where we're using it on the neck and the face. And this is, again, awesome improvement. And again, even on someone who's a little bit fluffy, this is a really nice improvement without a surgery. And it can be used in delicate areas like the lower lids and the upper lids. And again, and using the Morpheus, improving skin texture and tone. Now, we're just going to say stay tuned because our launch event for this is coming February 2021. Now, it doesn't mean that you can't learn more about it. Certainly, there are folks we've already done with this, but I will turn it over to Megan to talk you through some of the exclusive deals for attending tonight. And I just really appreciate y'all doing that and look forward to seeing some of you. Thank you, Megan.
Thanks, Dr. Bowen. So I know that we talked about a lot of different things today to just give you a very high-level overview of the various different procedures and treatments that we offer in our practice at Golden Owl Center for Plastic Surgery. As a way to extend our thank you, we have some exclusive deals going on for attending the event. So 20% off of all skincare products. We have a new VIP card this year. For $200, you get to enjoy these savings all year long. So you'll have $25 off of each area of Botox, $500 off of each syringe of filler, 10% off of all skincare products. And as a thank you, we give you a micropeel facial treatment for your birthday, which can be used in the month of your birthday. So the micropeel alone is $195. So that right there covers the cost of your VIP card. And again, you're able to enjoy these benefits all year long. We have a special going for Botox. When you purchase 3 areas, you're going to save $150. We also have a filler package where when you purchase 2 Voluma, you're going to get a free syringe of either Juvederm Ultra or Ultra Plus for free. That's a savings of $600. We have a mixed media package. So this might be great for somebody who wants to try these different treatments, or you're really looking to address the texture, tone, and coloring of the skin. So this includes a a VI peel, a Lumecca, which is the photo facial, and the Morpheus. This treatment does encompass the whole entire face and neck. And then there's a laser hair removal package for those of you who may be interested. It's a BOGO. So when you buy 1 set of 6, you're going to get your second set of 6 for free. For those who are interested in Y-lift or any of the surgical procedures, with a $2,000 deposit, you're going to receive $500 to be used towards any of the other various treatments that we do. Understand that by purchasing any of these deals, if you decide that you're going to buy one of them, but then you come in to receive your treatment, if let's just say it's not a good fit for you for whatever reason, or you're not a candidate for it, there may be a better option for you. We have no problem taking the value of that package and applying it towards something else. So it's not as if you purchase it and then you decide, okay, this really isn't for me and I want to go in a different route after speaking with Dr. Bowen or Caroline, that's money wasted. It can be applied towards other things. These packages are good for the whole entire year, so there is no limit to the number of packages that you purchase. So if you would like to have 4 different mixed media packages, that's completely fine. If you'll go to the next slide, Dr. Bowen.
Okay, hold on a second. There we go.
Even though we're not there in the flesh, we are still extending 3 great raffle baskets that you have the chance to win. All proceeds are being donated to the non-for-profit in Brunswick called Clean Your Plate. There is no limit to the number of tickets that you purchase. So for each $30, you're getting 2 chances to win. There are 3 different baskets. You have a gold, silver, and bronze. And as you can see, they vary in what's included in them as far as the value, the different products, the different services. So some great chances to win some great prizes there. And then Dr. Bowen next. Now, the great amazing thing with technology is everything tonight, including all of our skincare products, all of our specials, and the raffles, can all be purchased online. So if you visit our website at drdianebowen.com, up along the top banner, there's a tab that's called Shop. When you click on that, it brings you right into our shop, and it will look like this lovely screen with this beautiful brunette. In there, it has all of our products already listed at the 20% off. All of the packages are at their discounted rate, the VIP cards, and the raffles. So once you make your purchases, everything will be transferred into your account within our office. So this makes it super easy for you to go ahead and do your buying tonight. Even if after you go and have your dinner, you want to come back and do your shopping, that's completely fine. It'll be there for you. If you have more questions, please feel free to send me an email. You can reach me at marketing@drdianebowen.com. Email any questions that you might have. If you have any technical difficulties or something goes awry with the shop, please feel free to send them. I'm here to help. If you also have more questions into more detail about the various different services and procedures that we offer, email is a great way to send me your questions and I can help. And then when all else fails, the ladies will be back into the office tomorrow morning at 9 a.m. You can always give us a call. So we're going to go ahead and leave the chat feature open for the next couple of minutes. If you have any questions or concerns, please feel free to send them over. Email for the more private questions by all means. Dr. Bowen, I don't know if it'll be easier for you to go back to the special slide. This way folks can jot down what they might need.
There you go.
But everything, like I was saying, is listed on our website. So if you go to drdianebowen.com and click on Shop, everything that you see here is in there in addition to all of our products. As a part of purchasing online, you automatically have free shipping, so you don't have to worry about schlepping into the office to go pick it up. Yes, one of the questions that came through is, can you pick up a VIP card from the office? You can. The only thing that I ask is so that we don't inundate the office and have too many people in there at one time. Please send me an email so I can schedule you a time spot to arrive. But please know that if you purchase your VIP card through the online portal, it automatically goes into your account with us on Patient Now. So you don't have to worry about carrying around a card or a thing that gets scanned like the grocery store. We'll automatically see it in your account. This way, every time you go to make a purchase, we'll see your VIP card there. But by all means, if you already have a scheduled time spot to come into our office on Thursday or Friday, which some of you had requested, you can purchase the VIP card at that time as well. So thank you everybody for taking the time to join us this evening. We greatly appreciate it. I hope that everybody might have learned something or found something new, but we're always interested in hearing your feedback. So feel free to send me an email with what worked really well for you, what did you like, what did you not like, what would you like to see in future events. I'm always interested in hearing that insight so that we can make these events really beneficial for you. So thank you so much everybody for joining. We greatly appreciate it. I hope that you have a lovely evening, and we'll leave the chat feature open for another couple seconds and minutes in case there's any additional questions. But otherwise, feel free to log off.
Thank you so much for everything you've done, and thank you everybody for joining us.
I'll just give it another couple of minutes, Dr. B.
Sure. So now what is that? Is there questions in that where it says 9?
There was, but we answered them, and then there was just some thank yous and thank you for the creative events.
Okay.
Yeah. I think that's going to be all of the questions, and then there may be some emails that come through at a later point.
Okay. Sounds good.
Great. Thank you, Dr.
Okay.
B, and thank you, everybody else. I hope that you have a lovely evening.
Okay. Talk to you soon.